So just a few slides, just the why and what of this evaluation of this integrated care program. We try to move towards a healthcare system which can learn from research. So take some evidences from research, put them in practice, and then evaluate. So gather data from the healthcare system, and then refine and improve this evidence. This is the starting point of our use case for this evaluation with an integrated care program for stroke. So we knew from the evidence that patients who experience a stroke event and are hospitalized can very much benefit from continued rehabilitation and support after discharge. And this makes a difference in the health outcomes and the amount of activities of daily living that these patients recover. We can see what was the usual care pathway of patients with strokes. We see that in this usual care, at least in our country, this assessment of social needs, of potential social needs, is performed at the very end of the hospitalization process. So we decided to start making this evaluation right after admission and anticipate the needs at home and support that these patients will need, and start prescribing and starting all the process of this social support. By this central electronic health or integrated electronic health record, health social record, that took and gathered data from the healthcare system and from the social care system, which is not provided by the same administration in our country. And I think this is the case of many other countries. So we created this common electronic health record so that this evaluation of social care needs could be done at the beginning of the admission. We can see the percentage of patients in each of the group receiving domiciliary care, so receiving support at home. In red, you can see the percentage or the progression of percentage of patients over time in the integrated care program, and in green in the control group. So as you can see, individuals in the integrated care program were much more likely to receive support at home than patients in the control group. And finally, in this last slide, we look at first a very hard endpoint such as mortality and see whether this integrated care program improved these hard outcomes. And we saw that it wasn't the case. So people attended within the integrated care program had similar mortality rates over time than the control ones. But another outcome that we measured was the admission or institutionalization in a nursing home. And as we see in the plot on the right, individuals entering in this integrated care program were less likely to being admitted in a nursing home, or did it much later than patients in the control group, meaning that probably these patients had recovered more abilities to perform their activities of daily living and therefore more autonomy. And this is important not only from the point of view of the patient who these patients that living at home are probably had higher quality of life, but also from the point of view of the entire system, because admission in a nursing home is quite expensive for the system. So this is also a benefit for the entire healthcare and social care system.